Hi, my name is Karen Taylor, and I teach a class on infection prevention for the beginner infection preventionist. And it isn't always easy starting out, so I thought it would be a good idea if you had some tips for when you're starting out. And the first tip is to stay focused. It's very easy to get distracted. You know, you go out on the floor and start looking at something, and one thing leads to another. So, what you want to do is set aside a period of time every week, just like you would a meeting. Every Thursday from 12 o'clock to 2 o'clock, you're going to sit down at your desk and you're going to work on your infections, seeing whether or not the symptoms meet the criteria for an infection. The other thing that you're going to be looking for is an increase in the number of infections. What's going on? If you start seeing an increase in the number of urinary tract infections, then you have to think about why is this happening? Are they being hydrated? Are there too many Foleys in that need to come out? Or is it improper perineal care? You have a problem you've identified, so it needs an intervention, to prevent it from escalating. And if that intervention isn't effective, then you want to try something else. You evaluate it. And if it's not effective, then you go back and try something else. You also want to look at something like an increased number of upper respiratory tract infections. If you see a pocket of infections happening, what's going on there? You want to, if indeed the symptoms do meet criteria, then you want to shut that down. You want to make sure you isolate those residents or those patients to prevent an outbreak from happening. Okay? So keep it up on a weekly basis, on a daily basis if possible, but definitely a weekly basis. Don't wait till the end of the month, okay? Because then all you're doing is backtracking. Okay, so your first tip is to stay focused. Thanks.